Good morning and welcome to the Collaborative on Health and the Environment Alaska teleconference on protecting the health of Alaskans and our future generations through state chemicals policy reform. My name is Diana DeFazio, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. CHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. And CHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. You can find more information on the websites www.healthandenvironment.org and www.akaction.org. And before we get started, please take a moment to download Dr. Tickner's presentation if you haven't done so already. To do so, go to our website at www.akaction.org and click on the title of today's call, which you will find towards the top of the left-hand column of our homepage. You will arrive at a page dedicated to this call, and at the bottom you will find several links to websites and documents. And the PDF of Dr. Tickner's presentation is the first item listed. Again, if you're just joining us and you haven't already downloaded Dr. Tickner's presentation, you can find it by going to our homepage and clicking on the title of the call in the left-hand column. And that address again is www.akaction.org. The call will last an hour, and except for the speakers, all participants are muted during the presentations, and we'll have some time towards the end for discussion. Today we will be discussing some of the challenges of chemicals management and how states and local governments are going beyond federal regulation to protect their citizens and the environment from harmful chemicals. Later in the call, we will hear an update on legislation currently being considered by the Alaska State Legislature that would ban the import of products containing toxic flame retardant chemicals known as PBDEs. Two hearings for the bill are scheduled this week, one in the House Labor and Commerce Committee this afternoon and another in the Senate Finance Committee on Friday morning. And I hear a lot of people joining just now. I may have started just a minute early, so I'm going to give the instructions for getting to the presentation again. Please take a moment to download Dr. Tickner's presentation if you haven't done so, and you can find it on our website at www.akaction.org. And click on the title of today's call, and you'll find the link at the bottom of the page. We are incredibly fortunate to have Dr. Joel Tickner to lead us in this discussion of why we need to take the initiative at the state level to protect public health and the environment from harmful chemicals. Dr. Tickner is Associate Professor in the Department of Community Health and Sustainability at the University of Massachusetts Lowell, where he also directs the Chemicals Policy and Science Initiative at the Lowell Center for Sustainable Production. He is a leading expert on chemicals regulation, regulatory science, and application of the precautionary principle and safer materials in science and policy. He has served as an advisor and researcher for several government agencies, international agencies, nonprofit environmental groups, and trade unions, both in the U.S. and abroad. He was also co-coordinator of the Wingspread Conference on the Precautionary Principle, has edited 2 books on implementing the precautionary principle, and has over 100 publications and conference presentations on a range of topics, including chemicals policy, pollution prevention, risk assessment, and uncertainty and the precautionary principle. He serves on the editorial boards of several journals, is a peer reviewer for journals and government documents, and served on the EPA's National Pollution Prevention and Toxics Advisory Committee. Joel also directs the undergraduate environmental health program at the University of Massachusetts Lowell. He holds a Master's of Science degree in Environmental Studies from the University of Montana and a Doctor of Science degree from the Department of Work Environment at UMass Lowell, and for 3 years was an Environmental Protection Agency Star Fellow. Again, we're really fortunate to have Joel to lead us in this, as he has so much expertise in the subject. Joel, would you like to begin?
Sure. Thank you so much, and thank you everyone for being on the call, and it was a very generous introduction to me. I think many of you on the call have much more expertise and experience in toxics work than I will ever have, so I'm thrilled to be talking to such a distinguished group of individuals who are really working to advance a precautionary vision of chemicals policy. So what I'm going to try and do in my slides, jumping to the second slide, is to lead you through some of the rationale of why the states are uniquely poised to take leaders on safer chemicals policies, and think about some of the challenges the states face, and a little bit about where the states are at. And there's a lot of action happening. While many of us have given up a lot of hope on the federal level, the states really are and have been the innovators in environmental policy throughout the decades, and chemicals policy is no exception. There is a lot of work happening in multiple states to really build the coalitions and design the policies to address some of the limits in our current chemicals policy framework. So my presentation is going to focus a lot on several issues. One is talking about our evolution of science about chemicals and what we know and don't know, how that affects our current policy frameworks, talk a little bit about what's happening in Europe as a driver for what's happening here in the States. So there's a number of drivers, including European policies, state policies, and industrial policies that are really creating, and then the science, creating a ripe time to really move things forward. And the states, because of being the place where impacts actually occur at the state and local level, having slightly more flexibility in policy and really having an openness to innovation, it's the place to really create and affect change moving forward. And despite all the wonderful efforts of the federal coalition to change our federal chemicals policy, the Toxic Substances Control Act, that's going to take many years, and we'll come back to that in a little bit. So states remain in a very important position to push the federal envelope. So let's start the third slide. If my own slides will work here. All of you know about the buildup of chemicals in the human body. It's really in our environment, in our food, in our water, in wild animals, and in ourselves. And what this tells us is that there are potential for effects. We may not know the risk of every individual chemical in our bodies, but we know that having less in our bodies, in our environment, in our wildlife is better for our health and for ecosystems. The CDC's National Report on Human Exposure to Environmental Chemicals has come out on several iterations, finding fairly high levels of a number of chemicals across the human population, some at higher levels in pregnant women and women of childbearing age, which is a problem. I'm not going to go through all the science because I think the science is already there on exposures. The next slide talks about work that's been done on Cape Cod, Massachusetts by the Silent Spring Institute, looking at endocrine disruptors in U.S. homes. Pesticides such as DDT are still being found despite the ban on these chemicals 25 years ago, and PCBs as well. Next slide, looking at other types of brominated perfluorinated compounds in polar bears in Alaska. So we know the chemicals are getting there. Often we're not exactly sure what the direct source of those chemicals into our bodies or into our air, water are, but what we can do is say that they are coming from products. For the most part, those exposures are coming from products. So other issues such as lead in toys, I mean, the news is full of them. BPA plastic and the concerns about leaching from BPA plastic. Some of the new science, a study that came out last week from the Silent Spring Institute and the Breast Cancer Fund, finding that people who ate diets of traditionally packaged and canned goods, and this is probably an issue for Alaska, that have packaged and canned goods, if you take those out of the diets after measuring urinary levels of BPA and breakdowns of phthalates, which are used as softeners in plastics, you take those out of the diet and the levels go down up to 60%. So the researchers found that diet is an important contributor to exposure of certain chemicals like BPA and phthalates, and that there are ways to at least reduce direct exposures. Next slide. Another issue with BPA, though, is what are we moving towards? So as a response to amazingly powerful state advocacy campaigns and market campaigns, the marketplace shifted in terms of BPA in bottles in a matter of months. An amazing victory for advocacy campaigns, but the question is, what's the alternative? So this alternative that's being used in Camelback and other bottles is something called Triton copolyester, and the data are still out on whether it's going to be or might be a problem. So we may be jumping from the frying pan into the fire if we're not careful about having policies that ensure that we are shifting in the right way in terms of the chemicals we're using and assessing those alternatives to make sure they're indeed safer. So the next slide, slide 9, there's lots of data out there. The Collaborative on Health and Environment has done a wonderful job tracking the linkages between certain chemicals and chronic diseases, and they found about 180 chronic illnesses linked to toxic chemical exposures. Solid Spring Institute did an analysis of chemicals and found 216 mammary carcinogens in the literature. About 75 of those are found in everyday products. The data indicate that we have rising levels of asthma, certain cancers, and learning and behavioral disorders and reproductive disorders. And while we cannot explain all of these disorders on the basis of environmental factors, we do know that it just isn't simply better detection that is leading to those increased rates, or genetic factors. Our genes have not changed that much over the last 50 years to explain, for example, 160% rise in childhood asthma. So we know that there are lots of chemicals in us, and often we don't know exactly what the risks are of those, which is why we need to act in the face of uncertainty. Moving to the next slide, slide 10, our understanding of how chemicals are out there in the environment is also changing. Whereas 30 years ago, our concerns were large-scale emissions from manufacturing facilities, rivers catching on fire, acute illness, and cancer, and a concern about a smaller number of chemicals. As we learn more, we learn that exposures from everyday products, from chemicals that are used in everyday products that are dispersive, that are non-point, very difficult to control, right? You can control a manufacturing process, but if a chemical is in a product, it gets out all over the environment. We can't control it as well. And there may be a single point source, which is wastewater treatment, but wastewater treatment plants were not designed to deal with these types of chemicals. So when we're dealing with dispersed, non-point, multiple chemical exposures, really we need to be thinking about redesigning those chemistries in the first place, moving upstream and redesigning the products that those chemicals are in so that we are not exposed in the first place. So that gets to slide 11, where we discuss some of the problems in chemicals management that we face today. One is a lack of evidence or lack of information on most chemicals in commerce. We have a general idea that chemicals are treated like drugs, that they come onto the market with lots of data, they're tested to ensure that they're safe and efficacious, but in reality that's not the case. So the vast majority of chemicals out there lack some level of toxicity data, and even worse is understanding of exposure or even how those chemicals are used in supply chains. So often a user of chemicals may not know much about the chemical toxicity, or a government agency may not even know how that chemical is being used because that information is difficult to obtain. It's declared confidential. Second part is that most chemicals in commerce were assumed safe until proven dangerous by government agencies. So under our Toxic Substances Control Act, our primary piece of legislation at the federal level, all chemicals that were on the market in 1980 or 1979 were assumed safe, and then EPA, to be able to regulate those chemicals, has to, on a chemical-by-chemical basis, undertake a detailed risk assessment to demonstrate that there is a significant risk, and then they have to do a cost-benefit analysis to show that the benefits of regulation outweigh the cost to the economy, so that the benefits in terms of improved health outweigh the costs to manufacturers. And as I said, because it's very difficult to demonstrate those causal links between chemical exposure and disease, estimating those benefits of taking action are often very difficult. So this slow process has led to very little action on most chemicals in commerce, and a lack in public confidence, which is certainly increasing. And finally, if I can continue to use a chemical that's potentially dangerous, like lead, and lead works really well. That's why we use it. It's inexpensive and it works well. So if I can continue to use lead and no one's telling me not to, and there's no better alternative on the market that's cheaper, why wouldn't I continue to use it? So we lack those incentives. We put enormous effort and money into studying how bad some chemicals are but we don't look at those solutions. We put very little effort into thinking about what the solutions are. Next slide. What are the challenges here of this system? One is, if we don't know, if we don't have information, we assume it's safe. If it's been used for 40 years and there's no evidence that people have been harmed, even though we've never done the studies, we'll assume it's safe. If there is uncertainty in the risk assessment, so uncertainty about the level of exposure or whether the results in an animal study are relevant to humans, the default is don't act until we figure that out. So we have a very problem-focused approach to chemicals management, one that is based on, we need to know to the nth detail how dangerous something might be before we can act. And that problem focus takes away attention to considering alternatives and design. So it's very costly, it's very slow, and it opens the floodgates to what we might call manufactured uncertainty, creating uncertainty when it doesn't exist. So it is important to fill those knowledge gaps, but we have to understand that no system could ever do the level of risk assessments that we've been doing on every chemical for the thousands of chemicals out there. So there's a responsibility on governments to act in the face of uncertainty with the knowledge that we are never going to have perfect evidence, and we're never going to be able to get the level of detail that we really would like to have on every chemical. We could take dioxins as one example. We've been doing a dioxin risk assessment at the federal level for the past 20-something years, have not published a final risk assessment, and that has taken about, some people estimate about $1 billion of research money, and yet dioxin is no less toxic than it was 20 years ago. So we spend enormous amounts of money studying problems, so little money actually thinking about the solutions, and when those solutions may actually be good for the economy and good for health. So the next slide, slide 13. So what are the drivers now? There's lots of drivers out there. Perhaps one of the biggest drivers globally is the passage in 2007 of a new European Union piece of legislation called REACH, or Registration, Evaluation, and Authorization of Chemicals. So what REACH does is say for all chemicals in commerce, there's no longer this distinction between things that have come on the market and things that were on the market. Every chemical should have a base set of data, and that data should include some testing depending on how much of it's used. That manufacturers should be responsible for understanding how the chemical is used in supply chains, what the potential exposures are, and how to prevent those exposures. And for high concern chemicals, those that might persist or bioaccumulate, build up in our bodies, and chemicals that are potentially carcinogenic or toxic to reproduction, those chemicals should be treated like drugs. Companies should have to seek authorization to continue using those chemicals. So REACH has really created a whole new culture in Europe among businesses, actually for the first time having to collect that data, having to understand how the chemicals are used in supply chains, and having to look at alternatives for those chemicals of high concern. So the European Commission set up a new agency called the European Chemicals Agency in Finland. They actually just recently, about a month ago, came out with a list of the first chemicals that will be subject to these authorization procedures, and they are the phthalates, several of the phthalates, these plasticizers that are used in flexible PVC. So Europe is moving forward, and that has enormous implications for the U.S. For example, in the electronics arena where the PVDs have been widely used, Europe, through its electronics legislation, restriction on hazardous substances, has required the substitution of certain PVDs in electronic and electrical equipment and certain metals. And one of the things we've heard from U.S. manufacturers, for example, in my state of Massachusetts, we have a lot of, we're the second highest exporter to Europe, and electronics is one of the largest exports. So what we've heard from electronics manufacturers is they complain, but they lose their market if they don't make these transitions. So we heard from one manufacturer who said, we had tried to find lead-free options, for example, solder in electronic circuit boards for years, and within a year after ROSE, they had the alternative already implemented. So that legislation was what was needed to shift over that innovation curve to make it happen and get that implemented in practice. So provided a very important role, and we have very good evidence out there that regulation is critical to innovation. You cannot have innovation without regulation. So we come back to what's happening here in the United States, where despite all the action in Europe, we have very little momentum happening in the U.S., and that momentum has only been in the last about 3 years. So our toxics law, the Toxic Substances Control Act, is the only major federal environmental statute that has not been revised since it was passed in 1976. It has been, by many accounts, very failure in terms of getting adequate data and also regulating chemicals of concern in commerce. We're finishing some research right now looking at the history of implementation of Tosca, and certainly there's mixed reviews. I wouldn't say it was a complete failure. I think there are some parts of Tosca that we might want to preserve in a future iteration, but it's very clear that Tosca protected a lot of confidential information. It didn't get the kind of information on chemicals that we wanted to have, and it bound EPA's hands to actually act on chemicals in commerce. But a lot of the failures of Tosca weren't necessarily only the statute, but also thinking about the political momentum. So Tosca had no champions in Congress and really no champions in the administration for years. And also the procedural burdens that EPA has to go around to actually do anything under Tosca. And then lastly, the fact that Tosca is really seen as a second-tier statute compared to the Clean Air Act and the Clean Water Act. So resource-wise, that division gets very little resource to actually implement Tosca. But the results have been very narrow. So the lack of data on chemicals, again, EPA has a fairly high burden to even require testing. It's not required. EPA actually has to mandate testing, which has led to few mandatory test mandates for chemicals. It's very hard for them to get chemical use and exposure data or decent chemical use and exposure data. And then when they actually want to use their authorities to regulate a chemical in commerce, EPA has an enormous burden, and they have not used those authorities since 1991, when the agency went to regulate asbestos after about 10 years of effort, 10,000 pages of regulatory record, and they were told that they had not met the threshold under Tosca, showing that they're choosing the least burdensome measures to meet a particular risk reduction goal. So as a result, EPA in essence gave up in the 90s and really focused on pollution prevention. And in the next slide I'll show some of their successes in that area, but they really have done a lot on thinking about how do you assess alternatives to dangerous chemicals, how do you change the thinking about prevention, how do you put in the hands of chemical designers the tools to understand chemical toxicity and design safer chemicals. But again, if you look at the chemicals on the market today, almost 95% or more by volume were on the market in 1976. So it's not necessarily the new chemicals that are the problem, it's the existing ones. But we want to make sure that the new chemicals are indeed safer than the ones we have on the market. So Tosca really only regulates industrial chemicals and industrial uses of chemicals. If we think about other chemicals of high concern, for example, chemicals as food additives like BPA, or chemicals in cosmetics, such as the parabens, or chemicals in toys. Those are actually regulated by other agencies, the FDA for food additives and for the cosmetics, and the Consumer Product Safety Commission for toys. And the statutes under which those agencies work are even more restrictive than the Toxic Substances Control Act. So for cosmetic chemicals, for example, there is no pre-market testing requirement under the Federal Food, Drug, and Cosmetics Act, and for the FDA to actually act on a chemical in a cosmetic, they have to demonstrate that that chemical that the product is adulterated. Now that term adulterated goes back to the 1906 Pure Food and Drug Act, or Upton Sinclair's The Jungle. So there's absolutely no way FDA will ever meet that threshold for a chemical. Food additives, it's very similar, that there is some testing required, but there's a term called generally recognized as safe. So if a material is generally recognized as safe, and that's often an industry self-declaration, then there is no very little that FDA can actually do to regulate that chemical. And then FDA would only look at the uses of that chemical that may affect consumers in ingestion. For example, the artificial butter flavoring that's used in microwave popcorn, diacetyl, is safe under FDA regulations, but that chemical decimates the lungs of workers who inhale the chemical at the microwave popcorn plant. Actually, in one microwave popcorn manufacturing plant, 8 workers needed double lung transplants caused by exposure to the same chemical that FDA says is perfectly safe. Same thing with the Consumer Product Safety Act. So we have a very dysfunctional and jurisdictional approach to chemicals. Pesticides are similar, right? They're regulated under FIFRA, the Federal Insecticide, Fungicide, and Rodenticide Act. So we have no central authority to look at chemicals and then to think about alternatives. So FDA will never think about alternatives to a chemical of concern, whereas EPA does. So for example, on BPA, EPA is looking at alternatives to BPA in thermal cash register tape, but cannot look at alternatives to BPA in bottles because that isn't under their jurisdiction. So next slide. Some of the great work that's happening at EPA is really amazing on safer alternatives. So EPA is doing everything it can within its own powers today, and those powers are getting reined in by Congress. Their budget's getting shrunk, and also within the White House, the Office of Management and Budget, which is the regulatory COP, reviews all regulations and policies coming out. They've been pushing back on regulations coming out of the agencies as well, saying that they may hurt industry. So you have a lot of pressures against EPA, even though they want to take leadership, actually taking that leadership. But there's a lot of very good work within the agency right now looking at safer alternatives through its Design for Environment and Green Chemistry programs. So looking at slide 16, the EPA has issued these principles of reform for chemicals management, and those are useful to look at. They're working with Congress. Within the Congress, Senator Lautenberg and Representative Waxman have introduced bills on Tosca reform. There are hearings happening, but I would argue that any change is probably several years off, that you're not going to see the changes for a while. And there's a worry now that the industry is in there trying to muck around with those changes that may actually limit the authorities under Tosca. So let's jump to page 19, because really where the excitement and the energy is at the state level. States can go beyond federal regulations with regards to chemicals. They're not restrained by that. So we've seen a number of states dating back to the 70s and 80s, California with its Prop 65 in the 80s, really initiating chemicals policy reforms. And over the last 10 years or less than 10 years, seen these broad coalitions in states like Maine, Minnesota, Michigan, California, Washington, Alaska, Massachusetts. We've seen efforts at several local governments, and states are really starting to work together. The several states have formed what's called the Interstate Clearinghouse on Chemicals, which is a 11-state and one local government initiative to share data on chemicals, to share expertise, and to share information on safer alternatives. It's a great collaboration, much like the collaboration the states have done around mercury control. On slide 20, there's a number of different policies moving forward at the state level. Several states have chemical prioritization and ingredient disclosure type legislations where they take the chemical universe and prioritize it into higher and lower concern, often on the basis of concern about exposure to children. Some of those states have disclosure regulations that companies selling products that contain the chemicals of high concern have to disclose that information. Several states have pollution prevention or toxics reduction laws or policies on persistent bioaccumulative toxics. The most common type of policy happening right now at the state level are the single chemical restrictions, mercury, PBDs, lead, phthalates, bisphenol A, cadmium. While I would argue that's an important way to start building momentum for broader, comprehensive changes, one of the challenges of doing single chemical campaigns is we fight ad nauseum to win on a single chemical, and sometimes when we fight for bans without focusing on what the alternatives might be, we sometimes get alternatives that may not be so good. So one of the alternatives, for example, to the PBDs are brominated phthalates. which are also potentially problematic and showing up in the environment. So I think one of the lessons is if you're doing a single chemical restriction policy, make sure that safer alternatives is part of that policy, that you're directing the attention towards ensuring that you're not jumping from the frying pan into the fire. We see several states doing preferable purchasing, like in New York, where they're having a list of chemicals to be avoided in purchasing by governments. Governments buy a lot of stuff, and they have enormous market power. And then we have certain states doing multi-chemicals policies around alternatives assessment, and then states doing green chemistry or clean tech policies that are really about economic development in safer technologies. Next slide, 21 is an analysis we did of the state 2009-2010 legislative session. Goes through the single chemical restrictions like BPA, lead. I mean, so many more have happened since the 2009-2010 session. Certain ones on product categories such as cleaning products, cosmetics, certain ones about identifying, prioritizing, managed chemicals of concern, so Maine and Minnesota, and then several on green chemistry. And then lastly, this interstate clearinghouse is built into several state policies. Next slide is a slide from a coalition of state advocacy groups called the Safer Coalition, which is a group trying to share strategies and policy frameworks and advancing state policy to influence federal policy together. So it gives you an idea of 30 states announcing in January 2011 toxic chemicals legislation. So the states really are moving forward, and states you would have never thought of, like Georgia and Mississippi, moving policies forward. Slide 23 is just looking at several of the policies that are what might be called comprehensive or more comprehensive chemicals policies in Maine, Washington, and Minnesota. Maine's is currently under extreme threat due to the Tea Party government that's come into place and has put as a key priority the elimination of this law. One of the things that did happen was the state was able to get bisphenol A labeled as a priority chemical, which will require a ingredient disclosure process. But both Maine and Washington have prioritized their chemical universe. Washington this year tried to institute a bill that would require alternatives assessments for chemicals of concern, and at this point that bill has failed. And then Minnesota published a list of 1,700 chemicals of high concern. So this is a main way, and those lists are very powerful motivators for purchasing and for market change. I'm going to jump over the next slide, 24, that compares Maine's and Washington's bills, which are quite similar. We have a database which is going to be leaving us soon and going to the Interstate Clearinghouse, but it's still on our website, chemicalspolicy.org, where you can search by state, chemical type, product type for legislation that's either proposed, pending, or that has not passed on chemicals policy, and it has over 1,000 pieces of legislation. Just to go through some of the bills, the main bill is on slide 26. California has really taken a big step forward with their California Green Chemistry Initiative, which has been going on for 5 years now, starting with a report on the failures of chemicals policy at the state level, a series of stakeholder workshops, and slide 28, a Science Advisory Board final report that talked about expanding pollution prevention, having a toxics clearinghouse, accelerating the quest for safer alternatives, and then slide 29, their website. Slide 30, those recommendations by the science panel led to two bills, AB 1879 and SB 509. AB 1879 requires the state to come up with a list of chemicals of concern and to require alternatives assessment for those. They put out draft regulations out for comment over the last year, and that those regs failed in the last minutes of the Schwarzenegger administration because they were so gutted that the advocacy community and others felt that it wasn't worth putting in place a alternatives assessment regulation that really was not a very good one. SB 509 is about developing that database of chemicals, and there's draft regulations on that as well. Slide 31 just goes through some of the process of what's happened in California. I'll stop there. I'll skip over that, but it gives you some more, and I can answer more in question and answer. In Michigan, the key bill has been a state green chemistry bill. It was an executive directive that was focused on economic development around green chemistry and has resulted in an action plan for green chemistry, and quite a good initiative and some funding from the state legislature to bring stakeholders together to advance a positive vision of safer chemicals. In Massachusetts, the bill, the Act for Healthy Massachusetts, or the Safer Alternatives Bill, has focused on prioritizing the chemical universe and developing a list of chemicals and uses of those chemicals to undertake alternatives assessments to find better alternatives. That bill has been pending for several years, in part because of the challenges of getting any kind of environmental legislation through our state legislature. We do have a law on the books that's been around for 20 years now, the Toxics Use Reduction Act, on slide 34, that requires manufacturing firms to every year understand their chemicals, how they flow through the firm and how they're being used, and every 2 years to do a plan on how they're going to reduce their use of those chemicals and analyze the cost of those alternatives. They pay a fee that then funds voluntary technical assistance, research assistance, and training to firms to implement the safer alternatives. On the next slide, we show some of the results. We've reduced toxic chemical use by about 40%. This is just 2000 to 2008, but we've reduced by over 40% chemical use in the state. And certain chemicals like trichloroethylene, which is used in degreasing, we've all but eliminated. Meanwhile, the EPA still is undertaking a risk assessment to determine whether TCE is indeed a risk to humans. So we are now focusing on higher hazard chemicals and reducing reporting thresholds and planning thresholds for those to get to smaller quantity generators like auto body shops. So just jumping through the next ones here. Michigan, I won't go through any great detail of what's happened in Michigan. This is this is slide 37. Their green chemistry initiative is moving forward to try and advance green chemistry in the state, but not chemical regulation. There's a coalition working on chemical restrictions as well. Minnesota as well is working on green chemistry. Their Healthy Children's Bill, which did the chemical prioritization, also had a part that the state should do a document on options for green chemistry under the Toxic Free Kids Act, and that final report was sent to the state legislature and had several recommendations on advancing green chemistry.
Joel?
Yep.
5 minutes.
5 minutes, thank you. Good. That gets me. I'm moving along here. Connecticut last year passed an act to establish a Green Innovations Institute. That was June 2010. Unfortunately, because of the budget situation, anything that had a budget attached to it would not go through. So you have a wonderful Green Innovations Institute that has absolutely no funding attached to it. So another thing I might say in terms of strategy is unfunded mandates may be helpful, but they may also work against you. It's a great opportunity, but the Institute has not gotten off the ground because they haven't been able to raise the money to actually do it. Oregon has had a similar set of actions around green chemistry, a group of advocates and other stakeholders coming together to develop a blueprint for green chemistry in the state, and there's some scoping documents right now looking at broader chemicals reform in Oregon. So let me just quickly talk about industry, because industry is, in many cases, ahead of government. Really, in absence of government regulation at the federal level, many firms are beginning to use those market forces to push the envelope, in part because of consumer pressure, like about BPA in bottles, in part because of mishaps where they were caught blindsided, like Nike, for example, had found about 15 years ago the shirts, the jerseys of the German national soccer team were contaminated with a chemical called tributyltin, which is an antimicrobial, or it's a pesticide, and they got in big trouble for the threat of poisoning the German national soccer team. There's customer demands coming and marketplace demands. So you see the sectors much more effectively working together to go beyond regulations and to solve problems. But the business leaders are finding the same problems as the governments, lack of data, lack of good information through supply chains, lack of information on alternatives. So that's happening. Slide 42, companies ranging from Walmart to Dell to Staples are putting forward, seventh generation, putting forward lists of chemicals of concern. They're prioritizing those chemicals for phase-outs. For example, Staples has listed 28 chemicals in their products they sell that they want their suppliers to eliminate, and to show why they can't eliminate them if they can't eliminate them. Many firms are pushing, like SC Johnson, are prioritizing their chemicals for reformulation in their products, and there are incentives to designers to actually find safer alternatives to chemicals of concern. Some firms are requiring ingredient disclosure like Method or Seventh Generation, and some are instituting broader chemical use policies. Walmart, for example, is requiring that all chemical product suppliers provide all intentionally added ingredients into a central database managed by a private firm, that then those chemicals are screened against certain hazard criteria, and then the purchasers understand whether it's a red, blue, or red, green, or yellow chemical. Slide 43, some associations are putting out lists of priority substances or restricted lists. That's a very common approach. Slide 44 goes through that approach that Walmart's using. Also, Sears is using that, and several other retailers are likely to use it. Retailers are incredibly powerful in terms of motivating their supply chains. We have a network of companies we work with called the Green Chemistry and Commerce Council, which is really to bring together companies across sectors to put pressure on each other so that users of chemicals who don't need the chemical but the function that chemical provides can put pressure upstream on suppliers to find the safer alternatives. And we've worked with states on coming up with the incentives that industry really needs to do better in this arena. So in the future, what do we need in chemicals policies at the state level? Really, we need to be able to address all chemicals. We need to move away from these chemical approaches, from these single risk chemical bans, from risk assessments, finding acceptable uses of chemicals, and really start with a prioritization. What are the highest concern chemicals and uses of those chemicals or functions of those chemicals? To get the information about how those chemicals are being used, what their toxicity is, and then to have processes in place, alternatives assessment processes, to replace those chemicals with safer alternatives, and then incentives to promote the adoption of safer alternatives and to support innovation in safer chemicals. So really we need a broader approach than a single chemical restriction. And slide 48 is sort of what do we need to be able to do that? Well, we need information. We need testing on chemicals, exposure data, use data, knowing how they flow through supply chains, prioritizing those, having policies for chemical substitution alternatives assessment, having innovation in green chemistry, and being very clear that these things aren't easy. So you need to really focus on how are they going to be implemented, what are the barriers, how are you going to fund this, because that's going to be critical to any new policies. How do you actually do it in practice? We've written extensively about that, so I'll not go through that. And then we need areas of increased collaboration between the states. A state like Alaska doesn't have the resources to go it alone, so we need to build those examples of multi-state collaboration around safer chemicals. This interstate clearinghouse on chemicals is really an opportunity. Several states through the Environmental Council of States are working together on Tosca reform to make sure that state interests are maintained in Tosca reform. So it's imperative that Alaska play in that arena because of its unique exposures and unique impacts. So what are the lessons here? States are innovators. They have less worry about those jurisdictional boundaries. They don't have to worry like EPA worries if they do something that might affect OSHA. They can work more holistically on chemicals as chemicals and then focus on the intrinsic hazards of those chemicals and how we get towards safer chemicals. In many states, like Alaska, there are highly diverse and organized policy coalitions, and the states can really move from toxics policy to chemicals policy and from phasing out dangerous chemicals to phasing in. So states can work not only at the policy level and the restrictions level, but at the on-the-ground implementation level with manufacturers through, for example, manufacturing extension partnership. So we need to move from that focus on risk to the focus on alternatives. So really finding expedited ways to prioritize, assess, and really make decisions is critical at the states. So the states have certain strengths. They know how to support industry. They have the connection to institutions. They can innovate, and they can collaborate. Their weaknesses, obviously, are lack of data, challenges of implementation, so prioritization, defining what we mean by safer, knowing how chemicals are being used, collecting that data on chemicals in products coming into the state. Funds are critical, lack of expertise, and how do you influence those out-of-state market actors is important, and we're just learning how to do that. But just because it's tough doesn't mean we shouldn't do it. That just means we should find ways to solve it. It's a new way of thinking about chemicals, and it needs new solutions. So there are lots of opportunities in the last slide for Alaska to really take some leadership. States are and have been the leaders, and I think Alaska's unique position here as a recipient really makes Alaska in the position to take leadership in safer chemistry and push the federal envelope to be much stronger. And we really need big systems changes and new collaboration. So I'll stop there. It's a unique and exciting time.
Thank you, Joel, for giving us such a thorough overview in such limited time. I hope that if people have questions and want to delve into things deeper, that you'll speak up during the discussion time. Now I'm going to introduce Samantha English, Environmental Health and Justice Organizer for Alaska Community Action on Toxics. And Samantha's been working on our bill, Preventing Toxic Exposures Bill. Samantha is Gwich'in Athabaskan, Kagwantan Tlingit, and a lifelong Anchorage resident. She graduated in 2008 from Seattle University, where she majored in political science and pre-law. And after graduation, Sam worked as a public policy fellow in the office of Representative Beth Kurtula and as a rural affairs intern for Senator Mark Begich. Welcome, Samantha. Would you like to begin?
Hi, this is Samantha. Thanks, Diana, and thank you, Joel. Today I want to share information about PBDEs and exposure and emphasize the particular vulnerability of exposure in Alaska. Then I'll give an overview of the state legislation being considered this session that seeks to phase out the import of products containing the chemical flame retardants. And I'll finish with an update on the committee action the bill has had, and then explain how everyone can become engaged on this toxics issue. Polybrominated diphenyl ethers are a class of chemicals added to foams, electrical appliances, and other materials in common consumer products to reduce flammability. But over time and under normal conditions of use, PBDEs are released from products and become indoor and outdoor environmental contaminants. And humans are exposed through household dust, contaminated air, and foods. PBDEs can be ingested, inhaled, and absorbed. If these flame retardants were biologically inert, meaning they didn't have the ability to react, exposures might matter less. But PBDEs are similar in structure to the banned chemicals PCBs and dioxins, and thus have similar harmful effects on the body. We're concerned about them because they interfere with proper thyroid function, can cause damage to the reproductive system, and cause problems with childhood brain development, and can disrupt learning, memory, and behavior. What puts Alaskans at special risk for exposure are the chemical properties of brominated flame retardants. Its chemical stability means they can travel long distances and come down to the earth in cold places. PBDEs are also persistent. They remain in the environment and don't break down easily. They are also lipophilic, meaning they build up in fatty tissues and concentrate as they move up the food web. Alaskans have high levels of local exposure through household and office dust. Seasonally, we spend a lot of time indoors inadvertently ingesting more contaminated dust, especially babies and toddlers who are on the ground. Alaskans also eat wild foods that concentrate PBDEs. Marine mammals and some fish species are also of special concern. Unfortunately, the highest known concentrations of PBDEs in human populations in the Arctic were found in Yupik women from the Yukon-Kuskokwim Delta. Although there's no local manufacturer of this chemical in the state, it travels here through atmospheric currents in the wind and ocean, and there's evidence that levels in wildlife and people are increasing exponentially, doubling every 5 to 7 years in the Arctic. Here I'd like to make the point that we can't control these global currents, but we can control the import of products that contain this chemical into our state. There's recent scientific evidence about the health effects of brominated flame retardants that compels urgent action. Over the past year, Dr. Julie Herbstman of the Columbia University Center for Children's Environmental Health found that children who had higher prenatal exposures to PBDEs scored lower on tests of mental and physical development at ages 1, 4, and 6. Also in the past year, the San Antonio Statement, a consensus statement by over 200 scientists, emphasizes that brominated flame retardant chemicals increase fire toxicity, but their overall benefit in improving fire safety has not been proven. There have been many efforts to reduce fire death and injury without the negative side effects that result from these chemicals. These include numerous safety efforts like smoke alarms, greater public education, stronger building codes, safer designs of products like cigarettes and candles. Unlike PBDEs, none of these influences have negative side effects, and they've had a combination of far greater positive impact than any can be claimed for these chemicals. So the conclusion that's been lacking is the ability to enact legislation at the federal level to respond to what these studies are showing. The EPA doesn't have adequate authority to impose a ban on PBDEs. That's why states are taking action. Alaska would follow 12 other states who have enacted legislation to ban the import of products containing PBDEs that is not covered by a voluntary phase-out of the manufacture of the chemicals themselves. Senate Bill 27, sponsored by Senator Bill Wielechowski, will phase out the manufacture and sale of products containing penta and octa BDEs by January 1st, 2013. And it phases out the manufacture and sale of electronic products, furniture, textiles, and mattresses containing deca BDE by 2013. It also has an immediate effective date for the Alaska Department of Environmental Conservation to participate in a multi-state chemicals clearinghouse to build capacity to identify and promote safer chemicals and products, and also to enhance the efficiency of state initiatives on chemicals through collaboration. Alaska would share resources and build knowledge with other states. Initial enforcement will be on the manufacturers to provide product information. It is the intent to widely publicize the ban to signal the marketplace, educate companies on purchasing PBDE-free products, and for the department to conduct occasional spot checks on products to ensure manufacturers are in compliance. As Joel noted, Walmart has chosen to screen their products for PBDEs, and this is due in part to by state-level bans. This bill has received widespread support in Alaska. The Alaska Professional Firefighters Association joined the State Fire Chiefs Association along with numerous health professionals in writing letters of support. Firefighters receive firsthand exposure and understand their risk and acknowledge that equally fire-safe alternatives are available. Tribes from around the state have also shared their concerns about PBDEs being found in traditional foods and addressed the need to protect the health and well-being of future generations. In February, Senate Bill 27 was passed out of the Health and Social Services Committee and referred to the Senate Finance Committee. This bill was just scheduled a finance hearing for this Friday, April 8th at 9 a.m. This legislation has been a priority for several environmental groups this session, including the Alaska Conservation Alliance, which is an umbrella group for approximately 40 member organizations. They, as well as ACAT, have been working hard to encourage Alaskans to get in touch with their district senators and representatives. On the ACAT website, akaction.org, there's more information about the PBDE bill and fact sheets about this toxic chemical. You can also sign up on the website to receive action alerts that would provide legislators' contact information and talking points about PBDEs in Alaska. For the participants of this call, we urge everyone to contact your own district reps, especially if they are committee members of the Senate Finance Committee. Thank you again for calling in today. I hope this has been informative, and basically I would urge your support of this bill. I'd be happy to answer any questions or clarify information I went over, and I'm going to turn the call back over to Diana.
Thank you, Samantha, and thank you again, Joel. And we would now like to open the lines for questions and comments, so please wait a moment while we unmute the lines. If you would like to ask a question or make a comment, please press *6 on your telephone to unmute your line, and please state your name and affiliation. We also ask, since we have limited time, that you please be brief with your comments to allow others the opportunity to speak as well. So this is your chance to ask either Joel or Samantha questions or raise comments. Anyone want to speak up?
Yeah, Diana, hello. This is Pam Miller with Alaska Community Action on Toxics. And first, thank you Joel, so much for your excellent presentation, and Samantha also for giving a great overview of the bill currently being considered in our state legislature. This is a question for Joel. We're so pleased that you could join us today, Joel. It was just a wonderful presentation. I'd be very interested in hearing more about what you think we can draw from the best models that we have out there from the states such as Maine, Washington, California, and others in promoting comprehensive chemicals policy. Clearly, you made a great case, and I agree with you that we need to move from a single chemicals policy approach to more comprehensive. So I'm just wondering what you think we can draw from the best models out there and in promoting our own efforts here in Alaska toward comprehensive chemicals policy. And then secondly, if you would say something about how our legislators might consider that enacting comprehensive chemicals policy might provide economic benefits and incentives, because they're very concerned, of course, about the impacts that any legislation might have on business, and we think that this does promote innovation, of course. So if you could say something about how this might benefit business.
Great. Thanks, Pam, and thank you for the questions. So in terms of the first question here, what are the best, what are the key lessons that you could say we could carry away from some of the leading-edge state campaigns? I think one is understand the resources you have at your disposal in terms of chemical assessment, prioritization, et cetera. Use what's been done in other states. So taking advantage of chemical prioritization that's been done in other states and lists that already exist is very key. Especially in a state that might have limited agency resources, make sure that you're not taxing those resources. I mean, if you want to have, the last thing you want in a piece of legislation for your agency to come out against, there's no way in God's name they're going to be able to do it. So build off of that. I think having a prioritization process is a really good idea. Using what's been done already is a good idea. So once you have a prioritization process, it allows you to use market signals, purchasing, a whole number of other tools that you enforcement, whatever number of tools to move forward. Another lesson is start relatively small and build up. So to the and have a smaller number of chemicals to start up with, but have a where you're thinking about alternatives assessment or substitution, but have an open ability to increase that number so that you can see how the system works. What are the challenges you're going to face? That would be good. Joining the Interstate Clearinghouse on chemicals would be enormously useful so that the agency can share resources with other agencies across states. I think that's key. And then also thinking about how you can link your, put as much of the burden on the manufacturers to come up with the data as possible, and then also link to some kind of technical support to in-state manufacturers so that they don't feel like they're at a disadvantage compared to the big guys out of state, so that really you're helping, and this gets to the second part on the economic development. There's two key factors that is taught in the innovation literature that are key for innovation, which is willingness and capacity. So willingness, policy provides willingness, or some kind of market demand like purchasing or a retailer saying you can't use this anymore provides willingness. But one of the things we've realized is that even for the company that wants to do the right thing, they may not have the technical ability to do that, or they may be afraid that the alternative may not function as well, may be more costly, or may shut down their operation. So really making sure that technical support is there or research support through the university system to make sure that there is help out to industry. I think this is our main lesson from toxics use reduction in Massachusetts, is the key importance of planning, so that substitution is a process, not just the end goal, right? You want to make sure that people are looking at this and not trading off one risk for another, a community risk for a worker risk. And then part of that planning is really how do you support the innovation. And then getting to that, that idea of the economic benefits. Of course, it's hard to demonstrate the health benefits of a particular policy because there's latency between exposure and disease, or because it's very hard to demonstrate that XYZ exposure causes XYZ disease. We focused a lot in Massachusetts to find metrics. For example, toxic chemical use is our metric, and we've been able to show that use is down, and use is a surrogate for exposure, which is a surrogate for harm. We've also been able to collect that economic data. So as part of the planning process in the state, companies have to collect the data. Many firms put costs of using toxic chemicals in general overhead of the operation, and they don't attribute it to a particular production process or a product. So a product that uses a dangerous chemical may look equal to the product that doesn't. So if you change the accounting structures, you can show much more effectively that using safer alternatives is indeed economically beneficial. And then lastly, what we've had a hard time doing is for our clean tech work is showing why companies, all the benefits they might do by doing safer alternatives. So what we do often is show what are the impacts of not doing it. So for example, if you're exporting to another place, what are that has a regulation that says you have to do it. If you lose that market, what are the costs? And then case examples, showing case examples of where firms have done it and saved enormous amounts of money really shows that it can be done, one, and that there are benefits to it, two. So it's not easy, but I think on case to be made that innovation can happen and innovation does reduce costs.
Ew.
Joel, are you finished? I'm sorry.
Yeah, I'm finished.
Okay.
Sorry.
We are just at the top of the hour, so I do believe we need to wrap up, but I want to thank everyone again, participants and presenters, for joining us today. And if you have additional questions or comments, please feel free to contact us at 907-222-7714, or by email. You can email Samantha at Samantha, S-A-M-A-N-T-H-A, at akaction.org.
And Diane, people should feel free to email me as well.
Can you go ahead and give your...
Yeah, it's on the slides, but it's Joel, Joel, _Tickner, Tickner, at uml.edu, and our website, www.chemicalspolicy.org, has an enormous amount of resources on the subject.
Wonderful, and thank you for that. It's wonderful if people can ask you questions directly, so that's great. I also wanted to let everyone know that past calls, recordings of the calls, are on our website at www.akaction.org. Last month's call was on green chemistry with Dr. Lauren Hine and about safer alternatives to PBDEs. So you can find that there. And then in January, we focused on the health effects of exposure to PBDEs. And you can also find that call as well as a host of others on our website. So thank you once again very much, and don't forget to take action to support the bills that are currently being considered by the Alaska State Legislature. Thank you so much, and have a wonderful day. Bye-bye.